conducted directly by Professor Jeff. Jeff, for me, is like one of our father here.
What?
Father.
Oh, so you got my
Or grandfather. Or my grandfather.
Yeah.
Which one do you prefer? So Jeff came here not only for thesis supervision, but since last week, he already gave us as a resource person on clinical decision making, and then continued the proposal development, and then another 2 days for thesis supervision. For thesis supervision, it is not the first time for Jeff to come here as a resource person. It's already the 4th batches. The first one is in the same year, in the same month, but 2 weeks, and longer than 2 days. And then 2015, we had a similar one, but shorter, only 2 days. And this year, we have another one with Ibu Bapak semua, 2 days. The purpose of this workshop is to help Ibu Bapak to understand more how to supervise master students to make their own thesis. And based on our experiences, it was very interesting and intensive workshop because Jeff will not give any lecture. Jeff usually is only will give us question and question and question, and sometimes no answer. No answer, because he really want us to find the answer. In this process of a method like that, sometimes we as a participant can have several possibilities. First possibility is we fight to find the answer and have curiosity to find the answer. The other one is not fight but flight. Afraid, and we don't want to find the answer because it's too difficult. However it is, based on our experiences, participants were very happy because it seemed that they were not told. They were not told that, but they were challenged. The other experiences that we hope Ibu Bapak will experience is that we can put ourselves as a student, so we can understand more the difficulty felt or faced or encountered by students when they making their thesis. This two-day workshop is not a very rigid program from time to time like that, but there is program, and but you is just spread it and distributed to you. One thing that usually Jeff wants us is that we expect Ibu Bapak focus on this workshop by switch off the mobile phone during the workshop, except in coffee break and lunch. Jeff always answer our email promptly, but he never open email or mobile phone every minute. So I think this is, we already tried to do that, and I hope we can do that. Although I do understand for Ibu Bapak from hospital that perhaps emergency. This is the other one. The other one that I should mention as well, that we will have for facilitators, that facilitator in this term is not going to be resource person, no, but to learn together, and especially we want to observe how the workshop is conducted and how the workshop is going. So we will have today, this afternoon, Ibu Kristanti from nursing department. She is with us in Thesis Supervision team. And then tomorrow there will be Ibu Fitri from nursing department as well. She also will ask in the Thesis Supervision group. And tomorrow afternoon, Dr. Rina Triase, who always accompany Jeff, will join to be a facilitator. I myself will accompany Ibu Bapak this morning. So I would like Jeff to introduce himself because for me it's difficult to introduce Jeff and what side I have to introduce. Jeff has many expertise, including in internal medicine, including in clinical decision, including in thesis supervision, as well as including in building a house. And tomorrow afternoon, one of his expertise, we can sit together and I invite Ibu Bapak to come to auditorium because he will do his second concert in our faculty. Yeah. So because it's difficult for me, so Jeff, time for you to introduce more if you think you need it, and then to lead this concert. Thank you so much on behalf of the faculty. So again, respect and so many thank you, million thanks that you come again and helping us. Thank you so much. I also will switch off my mobile.
Hello. So, terima kasih. For most of you, this will be very special, what we are going to do. It might be also that you say, no, this is not my style, you should not stay. So then you go, no problem. What we do is to train in an interactive way. So you have to work all the time. I give you some questions and you work on the questions. And what we are going to do is to imitate the situation where you are supervising. Therefore, we should be at the same time also students. So we will be at the time supervisors, at the time students. So I will give you a task to write a protocol, and then we will comment on each other. And every time we say something, we say, dear student. And when you answer me, you say, dear supervisor. So we are going to do like a role play in that way. If you don't like that, no problem. But this is the way we already did in Nepal, we did in South America. So it's not something new, but it works very well. We have some rules that we work on only one thing. It means we do not work on a computer with WhatsApp also like this, and then discuss a little bit like that. With multitasking, because it's very bad, very bad. Actually, everybody is multitasking, and the things we don't do them well anymore. You can say, I can do a lot of things together. It's not true. I have to introduce myself. So I'm Jeff. I have worked for 10 years in Africa, 7 years in Congo, in the very, very bush, in the district hospital. And then after 15 years of the Institute of Tropical Medicine, I went to Rwanda, where I worked for 3 years in the university hospital. So I've seen the very low and the very high. And in the university hospital, they discovered I was professor, so the students came and they said, can you help us? And there I started to help thesis supervision, and I helped, I think, 100 or 150 students with their thesis. There I have also seen how you should not make a thesis. That is, I am an internist, specialist in tropical medicine. I did my PhD on malaria. I developed then clinical decision making. Then we worked on protocol development. I am married. I have 3 children and 6 grandchildren. That's it. Can I ask you now to present yourself? Just say in which, what your specialty is or in which department you are. Can I?
Thank you. Okay. My name is I'm a pediatrician. I work in Surgical General Hospital and I was consultant in gastroenterology. Here I check with the physician also.
I know you.
Hello everyone, my name is Gia. I am from the Department of Physiology.
Physiology.
Yes. But I am studying for my doctoral degree in immunology.
Immunology.
My name is Pramudjiyasati. I am from biochemistry and my especially about genetics.
Is it?
Genetics. My research about genetics.
Thanks.
My name is here. I'm pediatric hematologist and oncologist.
Pediatrics.
Pediatric hematologist and oncology.
Yeah, we already know each other, yes, but for the others, no.
Okay, my name is Agung Dewanta. I'm from obstetric and gynecology department.
Good morning. My name is Alifa. I am pediatrician from Neonatology Division.
Good morning. I'm Trisasi. I'm a medical doctor from public health department. Public health.
Public health.
My name is Widyandana, but you can call me Doni. I'm from the Department of Medical Education. Usually also supervising thesis, but now I'm studying ophthalmology and doing thesis.
Okay, thank you. My name is Hemi. I'm from nursing, from medical department.
My name is Rita. I'm from anatomic pathology department. Thank you. I'm Sri Hartini from Department of Maternity and Pediatric Nursing. Today, first time for me to study about thesis supervision. Thank you.
If I understand well, there is no clinician.
Only 2 from nursing department and 1 from pathology.
Pathology. Pathologist and biologist. A little bit.
So you are the
Health division.
Oh. I'm just thinking if in every group there is at least 1 clinician. Clinicians, yeah. Clinicians. You
We
are
have
clinicians.
3 clinicians here.
Yeah.
Ophthalmology
Would you
and
Yeah.
join
That's-
us?
Yeah. Yeah, that's better. And there's only 1 clinician. What we are going to do now is the following, and you already know because it's almost the same exercise. It's in another way, but now we work on supervision. We need protocol to comment on, so we work now on the protocol. And the protocol is the following, very simple protocol. The minister in Indonesia, the Minister of Health, he calls you and you go to him and he explains you that he has seen the statistics of the country, and he says, I think that there are too many patients treated for typhoid fever in this country. I see millions of treatments for typhoid fever. Millions of patients are treated for typhoid. He says, how is this possible? I think there's an error. And then he says, can't you give me some evidence? Can't you put a few students on a study to establish if this is justified, if these treatments are justified or not? So, he says, I think there are too many patients treated for typhoid fever. Go on. What I need is the title of your protocol, and I need the objectives. That's all. And you have 10 minutes for that, then you send it to me. My name is still there. And then we are going to comment on that like supervisors. Okay, 10 minutes. Let's start this. So we close the lids of the computers. Yeah. This group presents, and then we are going to behave like supervisors, one after another. Well, every group will say something, yeah, as a supervisor. Okay. Who will speak there? Supervisors, all supervisors. Look carefully because you have to comment.
Dear supervisors, based on the problem, our group proposed either influence factors related to increased incidence of typhoid fever, especially in subsequent people. Then our objective is to explore factors that influence the increase of typhoid fever among patients facing subsequent treatment.
Thank you, student. So think 2 minutes, 1 minute, and then every table can give his comment. You can discuss 1 minute, yeah, what you think about that.
Thank you very much, Prof.
Dear student,
This student would like to know what is the definition of influence factors here. Is it external factor from outside the hospital, or internal factors, or maybe internal factors inside the patient itself? Maybe you can describe or mention what is the influence factors that you mentioned here. Thank you.
Influence factors that we will examine is all factor, include the external factor and internal factor to the patient and to the patient actually. Internal and external factor from the patient.
It's good.
Comment on that before doing that, you have to be sure that the diagnostic pattern or how to establish the diagnosis is in the right way. Because when you do this research, this study, before confirming securely that the diagnosis is right, I think it will be biased.
Thank you so much.
Thank you very much, dear supervisors. Our groups, suppose it's the problem is already, the diagnosis is already established. That's a lot of patients will diagnosed as a typhoid fever in such a hospital. But treating patients, it's not the how to solve the problem, but it's better knowing the basic problem. So that's why we propose this title to know the risk factors, not only to suppose the diagnosis is already established and the patient is well managed in the hospital, but to prevent the endemic problem. So we propose this title to explore the risk factors. So not only treat the patient, but knowing the problem beyond this super problems. That's like this.
Yeah, I think it's good idea and good study, but this is based on the national guideline or maybe international guideline of typhoid fever. So you will sure that the diagnosis is in the right way, not an over-diagnosis that maybe influence the rise and the high incidence of typhoid fever.
Unless you are convinced what you are saying.
Oh, silent is good.
Short sentences. This group.
First, I would like to, dear student, I would like to know, is there any history of background that the incidence of typhoid fever is increasing in this? Thank you.
So this is a very good, yeah, all comments are important. We are going first to comment on all, and then we come back on. Yeah. Let's go for this. Speaking here.
Very good. What was the topic? The diagnosis accuracy of typhoid fever in Jakarta. The main objective is to explore the diagnosis accuracy of typhoid fever, and the secondary objective is to explore adherence to national guideline.
So we think for a few minutes, and then we will criticize your student.
Diagnosis accuracy you mean in this topic, that you have to state it clearly about this and to explore the adherence. I think between the diagnosis accuracy and the adherence, it's not in line, yeah, and because adherence is more that the clinician I think the compliance or something like that. So you have to state it specific and the objective. Maybe in the way of the doctor giving a prescription, or maybe in choosing the diagnostic tool to confirm the diagnosis. So I mean, this is about the adherence to the national guideline. But your objective is about diagnosis and process. So I think it's not in line.
Can you repeat that in one sentence?
Okay.
And
So
was.
yeah, because the longer sentence more unconvincing.
One sentence.
Yeah. So
Don't look at the screen, look at us.
the diagnosis in your objective and the title, I think it's not in line, especially about the diagnosis accuracy and the adherence to the national guideline.
So you say there is inconsistency between title and objective.
Yes,
Isn't that?
yes.
There is inconsistency between the title and objective. 7 words. 7 words. Now you can answer to that.
Okay, thank you, Supervisor. Nice comment on this. What I want to do is to confirm that the diagnosis is right. When the diagnosis is wrong, I worry that this will lead to the overdiagnosis. Mean the high incidence is caused by the overdiagnosis or misdiagnosis, not by the causes in the fact.
Let's see what these guys have to say.
We want to know, please mention about the previous study regarding the standard diagnosis of typhoid.
Can you repeat that? Not that it's highly interesting and so that it's already nice. She starts with a very positive.
Yeah. And I'm glad to hear that.
Please mention a previous study regarding standard diagnosis of the typhoid.
Yes, to give you some guideline according to the national consensus about the criteria for diagnosis of typhoid fever. As far as I know, as a hematologist, not as a tropical medicine expert, based on the clinical criteria, at least fever, and then from the laboratory we can prove the existence of the Salmonella typhosa based on the culture or maybe one of the marker. That's what I know. And for the concise criteria, I will come from the book. Ya. Terima kasih.
You have a very interesting topics. I just want to know what do you mean by adherence in your study?
Yeah. In a simple word, the right diagnosis based on the criteria will lead to the right data regarding the incident of typhoid. That's what I mean.
Okay, we have some ideas.
Propose a title clinician compliance to the National Typhoid Clinical Practice Guideline, and we have the objective to conduct clinical audit for the typhoid cases.
It's almost the same as what they did. And we will not criticize like this.
propose a title, typhoid or non-typhoid, on serologic test of Salmonella typhi. And the objective of this study is to determine the proportion of positivity on IgM and IgG of Salmonella typhi among patients with suspected of typhoid fever. That's our title and our objective.
Yeah, first few minutes to discuss what you are going to say.
I think that's interesting topic for your thesis, and we think that the sentence is not common for scientific. So can you reformulate the sentence, the title and objective for your thesis? Thank
What do we say?
Thank you for the suggestion. We will try to reformulate our sentence. Thank you.
Yeah, we like with your idea about the serologic test of Salmonella typhi, but we want to confirm whether in your idea you want to see the sensitivity or specificity of the serologic test. And the second question is why you use serologic test in your thesis proposal here? Is it a gold standard for typhoid fever? Thank you.
And test diagnostic. That's why in our title we analyze the suspected of typhoid fever because clinically already diagnosed by doctors as typhoid fever. We want to reconfirm what with the test diagnostic. And then based on our discussion, the gold standard is gall culture. However, gall culture is difficultly applied in Indonesia context. That's why we use a serological test as IgM and IgG of Salmonella.
So you accept the gold standard she gave you. Your supervisor said, are you going to use culture as a gold standard?
Yeah, yes, actually, gall culture is a good standard now, but maybe it's not available in a lot of hospitals in Indonesia, or maybe in a small hospital. And besides this, the result of gall cultures is sometimes only 50 to 2% positive. So the negative the negative process quite high. That is where we use the serology test that is more available, and maybe the result is the sensitivity is higher.
Supervisor, what do we say now? Not finished. What are you going to say now?
Yeah, actually, dear student, actually, maybe it is better if you use the gold standard in your study. But since we hear your excuse that maybe the gold standard examination is not very common in your setting, in your clinical setting, so yeah. We give you the opportunity to study.
No, now, you should now explain. She makes there's one part that is correct in her answer, one part that is false.
Yes.
So you should now, as a supervisor, explain to her what a gold standard is. Because she did not understand well. Yeah, supervisor.
Yeah, actually, we agree that the gold standard for Salmonella typhi for the typhoid fever is to do the gall culture. But since we hear that the reason why you didn't do that study using the Gal culture, so yeah, we will we see your excuse, the reason.
There are 2 points. First, a gold standard you don't use in the clinic. Gold standard means a test that you are going to do to evaluate other tests or clinic against it in a research setting. It's not, you said you can't use the culture in the, that's not, her question is, what is the gold standard to determine the sensitivity and specificity of your without test, your serology? That does not mean that you are going to use the culture in the field. You understand? A gold standard is something for a lab, for a research. I use this as gold standard and I will compare everything against this. This is basic philosophy of research and clinical research. And the second what she said is true, that for typhoid fever, the culture is a quite bad gold standard. Because in half of the cases, so you take 3 cultures, 3 times the bloods, the sensitivity is only half, it's only 50%. When you compare that to doing 12 blood samples and a stool and 3 stool samples also. So she is right and she was wrong. But you have to explain that as a supervisor. You understand? Yeah. Can you explain it again? Dear student, this is a training in thesis supervision. It's not a training in clinical research or something like that. Supervision.
Dear student, so the gold standard here to do the study in your idea is by using the Gal culture.
I would start by first saying, for half you are right. You start with the positive things. When you say you're right, why don't you say another? You say you are right that the culture as gold standard is relatively poor, but we have no other. On the other side, now you go on.
Oh, okay. Dear student, we are agree that you are right that the gold standard for typhoid fever is Gal culture, but based on the setting on your study, that but since the gold standard cannot be available, and you are right that there's a lot of highly negative of all or false positive from the Gal culture.
False positive or false negative?
Of false negative in your
I think your student is starting to look for another supervisor. Okay, sit down and this group should comment also.
It's a bit a blur in the objective because I mean the whole title and objective because the minister asked why there's too many patients treated salmonella typhoid fever. So this, I want to ask you that you want to do you want to try new tools, or do you want to answer the question of the list?
I understand your questions.
No, that.
Okay.
So the whole thinking of you is, do you want to test a new tool in the typhoid fever? A new tool, I mean the serologic test or mammography, or do you want to answer the question of the minister?
Okay. In our group, we translate the question of Prof. Jeff as many patients in Indonesia treated as typhoid fever. Is it right? And then we would like to know, is it the real case of typhoid or only the doctor states it as typhoid and then give drug as typhoid without adequate diagnostic. That's why we would like to examine the precision of clinical diagnostic with the diagnostic test as this is the standard, not new method. Not happen in laboratory as IgM and IgG salmonella.
Do you think that the tools that you want to know, you want to use is superior to the gold standard?
May I help her?
Yeah, of course.
I think gold standard is still culture, but maybe example something because besides the result of culture is quite long, maybe around 5 or 1 weeks. The result of culture. Yeah. For the diagnostic test, we are using serology test. It is quicker than the gold standard and has a high sensitivity. But it means that it will not replace the gold standard. But I think it's quite available for the clinician to determine the diagnosis of typhoid. What is your opinion, my supervisor?
No,
Wait. What the fact that you just speak to him, that we hear nothing, makes that he's just working on his. You should make that everybody listens to you.
Okay.
Speak to us.
Yeah. So,
But in one sentence now.
yeah. So, the gold standard.
To us,
still-
to us.
Yeah.
Speak to us.
So I mean that.
No, not to the screen. To us.
Okay, sorry, Jeff. So I think the gold standard for typhoid is blood culture, but the result for blood culture is quite long. I mean 5 to 1 weeks. But for this diagnostic, this kind of diagnostic test, the serology test, it is quicker. The result is quicker and more. I think has a high sensitivity and also available in a lot of our hospital. It is why I choose this to in this research.
So culture is late, and we think that here this has got a high sensitivity. Okay. We have of serological test. Which test do you need? TV doctors. Which test? 2 days. I have 2 days. What was your point? Who worked on compliance? Both of you. Both of you. If you say, I'm the minister, so I say, so you come to me and say, Minister, we are going to do this and this and this. As a minister, I say, yeah, compliance is nice, but are the national guidelines correct? might be that the national guidelines are not correct. So, who of you wants to work on the national guidelines? Correct, if they are correct or not.
Testing the national guidelines.
You want to work on it?
Yeah.
Yeah, okay. Fine. So they work on the national guidelines, and you work on compliance. Yeah. And you worked on the influence, yeah, but on the incidents.
Yeah.
And they said, are you sure that the incidence is going up? What? That's the first question. If you say the influence on the going up of the incidence, and you said, yeah, but you don't know if it's going up. So you have a problem. So you can work on the factors, yeah? And then I propose that two of you make a new group there, I don't know who, and they work on the real incidents. The real incidents. And the real incidents is with the gold standard. Who will sit here with two people? One goes there and one goes there. Choose. But there should be at least one clinician.
We have two clinicians here, only one here, and only one there, two over there. Only one clinician.
Is only one clinician.
Two here. Three.
Who's clinician?
Dr. Bandi is ophthalmologist, neurologist, and pediatrist.
Which one?
Oh,
Which one you want to choose?
and you are ophthalmologist. No, you are ophthalmologist. That's clinician.
Yes.
And-
Here, three clinicians.
Ah, three. Okay.
Neurologist, pediatric, and
So then, one
ophthalmologist.
goes there from the clinicians, and one goes there also. Who goes there? So you work on tubers, you work on national guidelines, if they are correct. Very different.
Di sini compliance, di sana realitas
And you work on influence, you work through incidents. Who's going there? And she sits there, so you can all look at the same screen.
Defines or what goes to group aspect, what they have to do.
To write again the title now and the objectives. But now correct, everything correct.
Ya, berarti kan yang baca rata-rata
Biasanya itu berarti
Harusnya bisa sih ya. Ini dotnya, tadi
Tadi yang maju jangan ya. Ya nggak apa-apa.
nanti dibantu loh ya.
In whom are you going to? Because you said about typhoid fever cases. Yeah, it should be. You should have an idea.
Jadi dia tanya FK-KMK dia seperti apa gitu.
Jadi
Baru kan?
kan gitu mungkin ya.
Betul. Kreatif. Contoh terus nanti bu? Enggak.
This was the first one. Or is it the new one?
We change.
Iya. Menurut saya tetap kita faktor resiko nggak apa-apa, tapi itu ada kelanjutannya. Faktor resiko dia.
Enggak sih, dia cuma yang verbalnya kayak gini, gitu-gitu ya. Itu, tapi itu mau ditafsir. Apakah dia memang setuju ataukah dia
Nanti dia buat video loh, atau Doni Agung.
Kalau bikinnya buat semua populasi ya nggak pede.
Ini kan enggak. Ya udah.
Ya tapi juga nggak apa-apa sih. Semua ini ganti clinician lagi.
Cara bilang.